Go ahead. Recording in progress.
Hello, my name is Dr. Sahar Lashin. I'm double board certified in internal medicine, anti-aging, and regenerative medicine. Being in the medical field for 38 years, I have seen a lot of human beings who really need to be taken care of. And being so passionate about the patient's health, to change them to healthy people and no more patients, I had to seek a little bit of a different pathway in the medical field. So started my medical field practice as a gastroenterologist, hepatologist. Also included in my practice was tropical medicine and infectious disease. I have seen an array of medications that didn't work. I have seen patients complaining about things and stuck there. And I have seen myself having these limitations, being a medical doctor, knowing everything I can know, and still cannot help my patients as much as I want to do. So, knowing this gap is present in the classic traditional orthodox medicine, I started to seek a pathway which can complement and integrate into my practice and my medical care for my patients to get better results. And so, starting the functional medicine, which is the basis of all the medical care, actually, I found how important it is to integrate the functionality of every cell in taking care of my patients. Having said that, I got my studies in Switzerland in Swiss Biological Medicine Academy and became one of the few doctors in the US who graduated from the Swiss Biological Medicine Academy. Including in my practice, all the knowledge that I have known in Africa, in Europe, and in the US, I started to take care of my patients on a different level. I call it a super specialty, not a subspecialty. It is a super specialty because it's the way the medicine is in comparison to Tesla style in the cars, for example. You're doing the technology and you're going back to the basics and you're fixing the root of the problem. So diving deep into the human cells, knowing exactly where the problem is, and then try to fix it from the roots is what really remain and help patients to be healthier, not just taking medications as a band-aid covering the symptoms the way that traditional medicine do. So when I am dealing with my patients, I deal with a human being. Human being is too sophisticated to be treated by a medication and a 15 minutes visit. Human beings need connection, need passion, need real care. This person need great attention to all the details. The soul, the mind, the health, it needs so much more than a medication or a medicine. So, taking care of the patients in a holistic approach, get the patient to the best results that can ever be achieved. And I believe that everybody now knows how crucial it is to take care of health in a proper time. Sometimes we're able to reverse everything if you seek medical attention in the right time. And that's why patients come and say, we were healthy. No, you were not. No proofs that you were healthy. Everybody has the wear and tear. Your car needs oil change. Your car needs gas. Your car needs attention to details. If your body is working every minute and every second, it does need maintenance. Actually, you need maintenance from intrauterine when you were given the proper food and vitamins by your mom. And after delivery, you have been taken care of in a very unique way and specific way. So you would build up your organs and you would maintain them and you would progress in life. When you start the decline and the catabolic effect because of all these stimuli, because all these attacks from the viruses and the bacteria and stress, which is a huge thing now, you're all the time stimulated. You have tons of emails to take care of. You are expected to be a superhuman power to take care of everything at the same time. There is no time to be sick. You really need to be healthy to the full, to the max, all the time. And going to a doctor's visit for 5 or 10 minutes, where the computer is the main interaction between you and your physician, is no more possible, is no more efficient or sufficient. You actually need much more than that. You need to see a holistic functional doctor the minute that you know that they exist, or the time at the minute when you are able to reach one. And this doctor you're not going to because you're sick, you're going because you don't want to be sick. So taking care of your health when it is good is as important, if not even more, than taking care of your condition when you're sick. When you're sick, you will go to the doctor anyway. But when you're healthy, you need to be intellectually on a level of culture, thought, decision making to get the time to see your doctor when you're really healthy. And when you do that, you will never regret a minute in the clinic seeing this doctor, because the results will be extremely obvious. You will stand out when you compare yourself to your classmates, to your colleagues, to your co-workers. And the reason is you can see how young and efficient you're functioning, much more than other people who are taking medications and stuck there. So if a patient think that, if you think that this condition is hereditary, good news is genetics have something called epigenetics, and we are able now, with this technology, with this knowledge, with the holistic functional approach, to prevent these genes from getting expressed. So if you're losing hair because your father or your grandfather was bald, can you imagine that we can stop that before it happens? Only if you can seek medical attention with a functional doctor who knows how to help you. And if you know the information or you don't, please seek the people that you can always ask and get a proper diagnosis, proper help, proper advice from, because there is a lot of people with no credentials out there claiming they know what they are doing. But you are smart enough to know who to ask, who to trust, who to go to. And doing that, you are investing in your health in the future the way that you invest in your FICO score. I always say, invest in your health score much more than you invest in your FICO score, because this will bring higher FICO score. It will bring joy for your life till the very last end, till the last minute that you are living in this life. You don't want to drag this body behind you or drag it around having pains, having disturbance, having metabolic problems. You need to be healthy to work, to enjoy life, to sleep better, to wake up in a better shape, to adjust your hormones, to do everything in your life on a minute-to-minute basis. And when you have this passion about your health, you will find the fruits blooming very, very soon. You will exactly know what I am talking about if you're having chronic fatigue, or you're already unable to sleep at night, or you sleep and wake up in few minutes, or you are trying to focus and you find that your intellectual functions are not the best, or you're suffering with every bite you're taking, or you're trying to achieve so many things and you become overwhelmed and then you give up and you can't do much. The best thing about functional medicine is that you can achieve the best version of you at any time. And when you take the step to start your health journey, that's when you start feeling better and better every day. So for so many times, I had patients sitting in front of me saying, oh, is it in our mind? We went to our doctors and they said, oh, it's all in our mind, but we don't feel right, we don't feel good. And we start our deep dive in their health, doing specific tests that are not traditionally ordered by the primary care doctors. We dive deep into the hormones, into the details of the pathways, into anabolic or catabolic pathways, which means, are you building up your body more than you're breaking it down? Or it's the opposite, which is not a good condition, where you are just getting exhausted more and more. If you're feeling exhausted, your body is telling you a message which you really need to listen to attentively, believe, and then take an action on. So if you're having some kind of disturbance and you cannot recognize what is it, go to a functional doctor. Talk to your trusted medical doctor, because he or she will have, I always tell my patients, you talk and I have a translation medically to what you're saying. Simply because I could, from the experience of 38 years in medical field, now I diagnose visually. That's how I joke with my patients. I can see the fatigue. I can see the stress. I can even evaluate how much it is. I can see the disturbance of hormones in certain wrinkles or something happening below your eyes, or skin texture, or hair loss, or the problems with the joints, or the functionality, or the way that you're sitting, how you're carrying your shoulder above the other one. Then there is a problem somewhere where I will take care of, or I will tell you how to fix it. There is a lot of things that visually I can diagnose you with, complemented and enforced by the very detailed labs that we now have access to. And then a very good plan of care where we're gonna take care of the priorities first, fixing what really matters in your health. Because if you have a blood pressure high, the body is telling you, I cannot get enough blood. I'm trying to increase the pressure so I can get more blood. So what we classically do in the classic medicine, we give a pill to decrease the blood pressure. Did we fix the origin of the problem? No. That's why you will never get better and you will never stop this medicine. But when you go to the functional holistic doctor and start discussing the problem of this body, who both of you know it has an origin and a point of fixation, you get better. You might even get rid of your medications. Not every time, it depends on when you sought your medical advice, but most of the time it can get much better. And the part of the problem is not only one problem and it's not connected to the rest of the body, it's connected to every single cell. Every cell is based by a lot of things, by your blood, by your lymphatic, by your food, by your hormones, by your chemical reactions, by your toxins, because there's tons of toxins everywhere. If you don't know that any infection in the periodontal area or around the teeth or in a root canal, all this can disturb the whole body. It can even cause autoimmune disease. It can even cause cancers, because cells get irritated all the time, are under pressure. And you know, when you have a nagging person around you and it keeps nagging, what happens to you at the end? You explode. You can't take it anymore, right? You react differently, not even your nature, not even the way that you usually do. And when this happens, the cells get crazy, and the control of stopping this cell from propagating is over. So it changed into a very quickly dividing cell, and consequently it changed to a cancerous cell, immortal, because every single cell we have in our body, it has a switch and it automatically kills itself after a certain period of time. If this process is disturbed by toxins, by pressures of any type, chemical problems, irritation, inflammation, viruses, bacteria, heavy metals, if it is irritated by anything, even stress, mental stress can cause it. If it is irritated, it loses control, and the cell become immortal, and then cancer cells start to happen. The good thing is now we can early detect if there are certain cells of that type circulating around. We can also detect if your immune system is competent enough to clear everyday's challenges in a timely manner. Because if it's not, accumulation of toxins happen, increase in the inflammation happen, and even worse, the cells start to be irritated to that extent. You don't want all this. We want to be many steps ahead of this cancer, or many steps ahead of this inflammation, or many steps ahead of the hormone imbalance, which can cause all of the above. So my main passion in every patient I see is to become a healthy person, get rid of the title of a patient, start in a proper and timely manner, know exactly when to seek medical advice, and this is as soon as you hear this video, and also who to ask, because it's crucial to be on the right path, in the right time, with the right people. So there is a lot of things that we can help you with, from knowing how to sleep, and knowing how to wake up, and knowing how to function, and knowing what to expect, and knowing what to avoid, and how to modulate your diet, how to take IV vitamins at certain times if you're traveling, not to rescue your immune system, not to risk it, to boost your immune system in a specific way, when to do acupuncture, when to do lymphatic drainage, when to do relaxation and meditation techniques, when to take these vitamins, when to do detoxification to your body, how frequent, what's the way to do it, how are your hormones, when to check them. If you know that every single second your hormones are interacting with trillions of receptors in your body, and if these reactions are not proper or adjusted, then you have money in your safe box, and you're trying to get it out from the ATM, and the connection is not there, and then you're deprived from your hormones. If you know that your testosterone causes you to be happy, functioning great, the go and get it achievement attitude, both for men and women, by the way. So the women suffer a lot losing their testosterone. For example, starting from late 30s, most of the patients I see have this problem of fatigue, lack of concentration, some memory troubles. You start looking around for your keys, or this paper, or this word that you want to say, or the thought that you forgot. And then you start feeling that you go to the gym and you do everything that you can, yet muscles are not showing. There is nothing going on in spite of exercising every day. Or you start to accumulate fat in areas you don't want to see fat in. or loss of libido, intimate life, what I call midlife awareness, not midlife crisis. Crisis if you don't actually control your hormones and your health in the right time. But midlife awareness is when you become aware how your health need some adjustment, and then getting to the doctor and complaining about specific thing means a lot of projections from the background of your complaint that need to be addressed. So when your heart start to have fatigue in the muscle, for example, that's a very late condition. You cannot wait till then. You cannot wait till your blood pressure is high or even borderline. It has to be flowing good. You cannot wait till you feel fatigued and you cannot function right. Don't wait if you're not sleeping well. Don't wait for the hot flashes. See us earlier. Prepare for the future, the way that you prepare for guests coming, because you don't know exactly what's gonna happen if you don't prepare. You shouldn't get this impression that as long as you're pushing yourself, getting up every day, going to work, finishing this day and coming back, then you're doing well. No. With time, with the wear and tear, just exactly like the way people show their age on their face and their skin and their hair, and they start losing the hair or they start having these wrinkles, it doesn't come clear over time or overnight or over a few months. It is an accumulation of oxidative stress, accumulation of toxins, accumulation of not being able to regenerate correctly. So being a GI doctor since 1993, let's put it this way, knowing that the gut is as big as a golf course, with every single cell just side by side, very thin cell, yet there is guards on both sides protecting these cells, protecting you from everything you're putting in your mouth, and even what you take as a medication, even if it was IV, it gets secreted in the gut to some extent. So getting treatment for something that can affect your gut, eating anything can affect your gut. Not eating can affect your gut. It depends on what we are dealing with. So those who have like a duodenal ulcer, for example, which is the part that is after the stomach, they need to have all the time, we call them the patient with the biscuit in the hand, because they cannot have an empty stomach, otherwise the acid will eat up the area and give them severe pains. So for example, if you come to me and say that you get this heartburn, I have to take it seriously. If you're taking an over-the-counter anti-acid, I am now very alarmed. And the reason is, open up the side effects of the anti-acids and take a look. How many side effects are there? And it's all somehow acceptable. I don't know why. And people have been taking anti-acids in some practices for 10, 12 years, even more. I get patients saying, oh yeah, I have been on the anti-acids for 15 years. This is totally unacceptable. As a functional, holistic, internal medicine, GI, liver doctor, I cannot accept that. And the studies now shows clearly that there is a correlation between anti-acids and dementia, which was not known many years ago. And like 100 years ago, there were not as much as dementia and Alzheimer, if at all, the way that we have now. If we know that the extremely popular medicine like the cholesterol pill is having studies showing for sure and clearly that this medicine is related to liver enzyme elevation, then we have to take care of the liver if you are on one. It eats up coenzyme Q10, which is protective on the heart and naturally produced in small amounts. If you are on a medication for cholesterol, crucial, you have to be on coenzyme Q10. It's a simple thing, but make a big change. If you are on specific medications which can decrease specific vitamins, then you have to be supplemented with these vitamins. But when you go to classic classic medical care, a lot of people don't put two together because they don't have time or they don't have the knowledge. So knowing now where I used to be before diving deeper into the functional holistic medicine, knowing how much there is missing parts in the puzzle of my patient's health, I am much more able to help my patients who now, instead of sitting in front of me saying nothing changed, they come and say, we feel better. And now I am happy because your health is my personal challenge. If you get better, that's my signature in life. I got somebody better. That's why I studied my whole life. That's why I went to medical school at age 16. That's why I continue to be a doctor. I have never seen myself other than a medical doctor my whole life. I want to fix it. I want to fix your health. I want to fix this problem. I am very passionate about hearing that you are now better. This is what the essence of life. And when you feel better, you will be functioning better, you will be looking better, you will be younger. We don't care much about your chronological age. How old are you or how young are you, it's just a number. But how biologically old are you is what really matters. How your organs are functioning, how young they are is what really matters. And happy enough to say that we have ways now to measure it. We have ways to measure before and after the procedures. And we have tools to make it happen. We have vitamins, we have peptides, which I love because it goes deep down inside the cell, fix the area where the helix is, where the proteins are, the machine itself. So my approach to my patients is, if I recognize and diagnose a problem in a cell or an organ, I look into the machinery in this area, which is the DNA and the nuclei of the cells. It's the genetic makeup of your cell. And then we fix that part. And then we give the machine the proper food to use, which is the supplements and the vitamins, and then we clean the milieu around this cell. So we clean the environment, the interchange. We want to make it a clean interchange between the cells and each other, the cells and the water around it, or the serum, or the blood, or the lymph. We want every area you are interacting with on the level of the cell to be clean, to be efficient, to not suffer from toxins or accumulative oxidative stress or heavy metals or viruses or bacteria or anything that can disturb your inner milieu. Once we're able to achieve the equilibrium and the clean internal environment, your health will be better, your life you will add life to your years, not just having years in your life. You will be able to carry this body in the best shape. I call it tree chic health. It's how you can look outside great, but you function inside greater too. And when this is our goal, both of us, we achieve a lot. So most of the people now, they work. They don't have time for their health. They keep working. stressing their body, and then the body has to break at some point. And then instead of enjoying the retirement or enjoying the free time they might have, which usually is very limited, or their vacation, they start having medical troubles and health problems. And so now what they have saved for the future, they are just exhausting over disease and sickness. But I would rather to live healthy, to invest in my health, so when I am able to have quality time and quantity of few days as a vacation, I can get the maximum out of it. I can invest in my health now, so I can retire healthy, happy, in the best shape, enjoy all the years that I have been working so hard in to save this money, not to put it in a nursing home or an assisted senior living, but to enjoy it traveling the world, doing all the activities that I want, enjoy my grandkids, enjoy my friends and my family. It's a totally different setup. So when do you need to address certain medical conditions, for example, like perimenopause or the health of your hormones? Well, as soon as you know that we exist. So I have patients who are as young as 16 years old, and they have irregular cycles, they have obesity, they have insulin resistance, they have hair growing in the face, losing the hair here. There is a lot of troubles that can happen with early on with the beginning of the menstrual cycles. Some even don't have regular cycles. So how do we do, how can we help these patients? Knowing, is it a PCOS or endometriosis or excess estrogen or lack of progesterone or excess testosterone or DHEA or thyroid problem or adrenal gland. You see how extensive it is? That's only the hormonal part. There is other metabolic parts. There is a lot that we need to address. So taking a deep dive in the health of as young people as 16 or 18 can provide them a long life of healthy and better health, better life, than waiting till when they want to have a baby or they want to conceive in a specific time in their 30s and then try to address it. It's sometimes too late. Sometimes certain things are difficult to control, but never say never. There is always a hope to start and to get results. So for those who are young and have hormone imbalances, there is ways to make you regulated and better regarding this. Don't go with the genetic stamp. It's in me, I cannot change it. No, there is much more above and beyond in medical care now than what can be done in a classic medical setup. And those who are like certain men who are seeking to be more fertile, who are seeking to build a family, there is a lot of things that we can do to help these people too. So we treat couples, we treat men, we treat women, we treat adults, young adolescents, all the spectrum of ages except kids. I can advise. So there is some other people for the younger age till 18 or 16. Also, the andropause is a problem that some people don't know it exists. So andropause is a problem in men which happens very early, and lucky enough we know how to help them in their andropause too. So disturbance in hormones in men Because the testosterone is soaking their bodies, they always feel good, because testosterone is the hormone of achievement. That's what I call it. Achievement hormone, happy hormone. May make men feel great for a long time and ignore what the body tells them. That's why most of them, they work. I had a patient last week. He is in his 50s and a nice gentleman, highly achieving a businessman, and he told me, oh, I feel great after I changed my blood vessels in the heart. You know, the cabbage went very well, and now I feel much better. I'm back again to full power to work. Is that right? No. Problems that had happened over the previous 30-40 years cannot be fixed by a surgery alone. You need surgery, and you need millions of other interventions on the sides, so you never have this blockage in your coronaries again. So you never have to live with that much high blood pressure and the side effects of the medications. So you can lose this extra pounds, so you can adjust your health. There is a lot that can be done in all the medical problems that before we thought we cannot do much in it. Diabetes is the same thing. If you have an open buffet for desserts, for sweets all the time for your cells inside your body, do you think bacteria and virus will not be invited? They will be invited. They will stay there for a long time, and that's why they get infection after the other. When you change this milieu, you get much better results. When you tightly control the metabolic problem and the roots of this problem, you will get and achieve much better health for every single cell. So taking care of your gut, taking care of your hormones, taking care of your health in general, taking care of your mood, taking care of your stress, taking care of your mental, physical health is an incorporated process that at the end give you a great effect and a great result that can be seen, felt, and can be measured too.